All right, so I'm Amelia Davis, and I'm a psychiatrist at the University of Florida. And as he said, I work in the eating disorders and obesity program there. And kind of thinking about this talk, I was thinking about what might be beneficial for you all. And so I decided I'm going to spend some time on binge eating disorders, as well as new research on food addiction. And then at the end, I'll have just some weight loss tips, I guess, at the very end. So thank you again for having me, and it's a pleasure to be here. So just to kind of tell you a little bit about where I'm coming from, we have an eating disorder recovery center at the University of Florida that opened about 2 years ago. And we have inpatient, a day program, we have outpatient, and a lot of our treatment is with anorexia nervosa and bulimia nervosa, treating individuals there. And it's a great program, but pretty new. So I just wanted to let you know that I'm coming from that background. And then we also have a Best Life clinic at the University of Florida, in which we help individuals sustain permanent and sustainable weight loss. And we use lifestyle changes, nutrition therapy, as well as sometimes we use medications to help facilitate some weight loss and for people to achieve their weight loss goals. So just kind of going, I'm going to talk a little bit about the binge eating disorder. But to begin with, what is an eating disorder? I'm not sure that many people are aware or maybe have not had information about eating disorders. But basically, it's eating disorders in general, which can be bulimia or anorexia or binge eating. Can be, they're serious emotional and behavioral mental health conditions, and they disrupt an individual's ability to handle food. And usually it's not just about the food, but that there are underlying psychological or mental health conditions that are kind of driving the behavior. So in a sense, food can become kind of an emotional thermostat. It can be kind of used in a way to kind of regulate emotions, like feeling depressed or anxious, bored, and sometimes you can imagine if you're feeling have a hard day at work or whatever's going on, stressors with your significant other, and you might use food to kind of try to cope with those foods. And sometimes, I think to a certain extent, a lot of people in some way or another, use food in that manner. And then sometimes it can become to the point where it actually is, can be very disruptive to your life. It can impact you in terms of your, ability to function. And can, in the case of binge eating disorder, can lead to becoming overweight or obese, which can develop, certain medical conditions like diabetes. Certainly, to have binge eating disorder, an individual may not be overweight. They could be normal weight, but unfortunately, the risk could lead to becoming overweight. So some of the behaviors that people with an eating disorder may be food restriction, meaning they limit the amount of calories that they eat in an extreme manner, or it could be the other way, excessive consumption of food, or even binge eating is where an individual's eating a large amount of calories in one sitting, and it's usually to the point where it's very uncomfortable and can be excessive. Other eating disorder behaviors can be purging, such as vomiting, laxative abuse, compulsive exercise, and so that happens in bulimia nervosa, and then compulsive and rapid eating. So binge eating disorder is, of the eating disorders, it's the most common one, and probably the one that people don't really know about as much, may not be as familiar with. So it actually occurs in about 3.5% of women, and 2% of men have reported in some time in their life having a binge eating disorder. So still not a very large, portion of the population in terms of you think about the obesity and epidemic where we now have about 1/3 of individuals are either overweight or obese, but certainly a significant amount of people that may not be getting treatment or may be struggling with this. So a binge eating episode, basically binge eating disorder is when somebody has recurring episodes of binge eating. So they might eat, have these episodes where they eat like, a whole thing of ice cream or a whole bag of chips all at once, and they're not hungry. So they're eating to the point of feeling usually overfull and uncomfortable. Oftentimes it's done in secret because there's a lot of shame and guilt surrounding the episodes, and they eat large amounts of food even when they're not hungry. There's usually, during the episodes, someone may feel, like they're kind of getting high or feeling good while they're doing it, but then afterwards, often people feel, a lot of shame and may feel, disgusted or guilty about what they ate. And like I said, this can, these kind of behaviors can lead to, can be very distressing psychologically. Why do I keep doing these behaviors? But also can lead to some serious, medical problems that aren't fixed just, with going on a diet. Because, a lot of times, some of the treatment involves getting kind of to the root of the binge eating and what are the reasons for the binge eating episodes. So some of the causes are unknown. It appears to be a combination of psychological, biological, environmental factors. Eating disorders in general they run in families. There's, if you have a family member who has an eating disorder, you're more likely to have an eating disorder, and just through genetics. But also some environmental factors. We also know that binge eating disorder is associated with increased depression, by about 2 times more likely to have depression if you have binge eating disorder. Other things, sometimes you can imagine it may develop, either in adolescence or childhood. An individual might use food as a way of self-soothing or some comfort and reward. And then other contributions could be medical in nature, like someone could have medical illness that's increasing their appetite, or could have be taking medications that can increase their appetite. That could kind of facilitate this or worsen it, I mean. So in terms of treatment for binge eating disorder, fortunately there is help out there, though it can be something that somebody struggles with for a long time. But one of the evidence-based treatments is cognitive behavioral therapy. And that's a type of therapy that's used in major depression as well as obsessive, to treat obsessive compulsive disorder, so different kind of mental health conditions. And it's a way in which someone kind of, the therapy focuses on the dysfunctional thoughts and behaviors and kind of helping, somebody become more self-aware of the behaviors that they're doing. So, and then kind of problem solving or thinking of other ways in which they can cope with those difficult emotions and behaviors. Part of it can be recognizing what are the triggers for the binges. So for instance, if, like I was saying before, a lot of people can engage in emotional eating, and it may be that the binges, like I said, aren't really about the food, but more about what's going on at work, or what's going on with, are you feeling, did some stressor happen, and then you use the binges to try and kind of cope with that stress. And then there's also some support groups, and one of the ones that are out there is Overeaters Anonymous, which is a 12-step kind of program where people talk about their difficulties with overeating. And it's kind of an anonymous support group where people can come that's free. And then there's also some medications that have been looked at for binge eating disorder. The 2 primary classes are the antidepressants, so like the selective serotonin reuptake inhibitors, or SSRIs. Those are like Prozac, Zoloft, Celexa or Lexapro. There's a number of them in that category, and they're used primarily to treat depression, but they've also had have done research, and they've found that it's reduced episodes of binge eating, and it's also, those medications are used for treatment of bulimia nervosa, and they found that, they don't, individuals might take it for several months, and then they'll find that the episodes of binge eating kind of reduce. And it might also be helping if, like I said, there is an increase in depression in people who have binge eating disorder, so it may also help treat the depression. Now, the other medications that have been used are anticonvulsants, so meaning they're used for epilepsy or seizure disorder, and they've found that some of these medications, primarily topiramate, which is Topamax, and zonisamide, which is Zonegran, these medications cause people to lose weight who are taking it for other reasons, and some of them kind of alter the taste of food a little bit, so maybe the individual doesn't get like as much pleasure or satisfaction from eating. And they found that it in some studies have reduced kind of the obsessions about food and eating. Though these medications would be off-label. Currently, there's no FDA-approved medication specifically for treatment of binge eating disorder at this time. So that's that, and then, so that's binge eating disorder. And then I wanted to talk a little bit about food addiction, which is very similar to the binge eating disorder, and there's a lot of overlap. And food addiction is something that's kind of a new concept that's been coming out more recently. There's been more research geared towards food addiction and trying to figure out how is food addiction different from binge eating disorder, which is a good question to ask. So, while binge eating, like I said, it's these compulsive episodes where someone eats like a large amount of food all at once, usually within like 20 or 30-minute period of time. It might be similar to like what people eat at Thanksgiving, where people overeat, but it's repeatedly. It occurs repeatedly, like once a week or more. Whereas food addiction is talking about kind of the biochemical dependency on food. So more of like food, looking at certain types of food that are similar to like a drug, in a sense, like sugars, fats, salty foods, or a combination of those, whether people become kind of hooked on those foods. And again, it's a different kind of concept. So, some of the, looking at whether people get, physical cravings for foods, whether they have kind of an obsession about foods. They might even distort, have different unusual behaviors that they might not even be aware of in relation to the foods that are similar to someone who had like an addiction to like cigarettes or alcohol or some sort of drug. So kind of, some of, maybe someone might, they might always go home a certain route, and, they go by like a fast food place, and they just always get that fast food, and it kind of gets into kind of a habit. And, or another thing would be, kind of overeating to the point where the next day you don't feel well, or even after not feeling, physically not feeling well. Or maybe even, individual going to like a party or an event, and all they're thinking about is the food. The first thing they come is like, what's the food? Not really thinking about that this is kind of a social gathering to kind of have fun with interacting with other people. So the foods that we're thinking about, because you might think, well, how can food be addictive? We all need food, right? We all eat food to be healthy. So what they're kind of defining as the addictive foods would be the highly palatable foods, again, rich in sugar or fats or salt. So is food addictive? Good question. Certainly, I put this slide up because certainly the advertisements or the way that food is advertised, it appears that it would be in terms of a lot of craving. The Pringles logo is once you pop, you can't stop. It's like you can't have just one, you have to have multiple. And I'm sure a number of individuals here have probably encountered that, where it's like you have one chip and nope, that's not happening, right? So definitely something that, and the way, you go down Archer Road and there's all kinds of, fast food places. It's can be very tempting. So what's kind of the background, and why are we thinking about as food as being addictive or whatnot? So they've come up with some new research, and they found that when people eat highly palatable food, some certain neurotransmitters, which are like certain chemicals in the brain, such as dopamine and opioids, are actually increased with food. And this also occurs when people use drugs or alcohol or smoke cigarettes. So it appears that there is, in that way, there's at least some overlap. Dopamine is one of the neurotransmitters, and it regulates pleasure. It's very motivating. It's actually what's released when someone does cocaine or uses cocaine. And the dopamine reward system is a certain tract in the brain that appears to be hijacked when someone's addicted to other forms, not just drugs, but also gambling addiction. And they've done studies and found that this is also the case with food. The other neurotransmitter is opioid, which that's in morphine or heroin. It's a highly addictive substance, and that medication or that substance chemical relieves pain and can produce euphoria. And that's also been seen to be involved or increased in individuals who, when they eat highly palatable food. They've done studies. They found that when they injected with an opioid like substance that increased the opioid in the brain, that the consumption of highly palatable foods increased. And then they've also found that when they blocked that receptor, people reported less pleasure when they ate food. So again, I think it's kind of a new research that's coming up, but still very intriguing, at least to imagine what are the overlaps between food and either alcohol or drug use. So some of the other things that are overlapped is that they've done PET scans. And they found that when that the scans are similar in people who have been people who use drugs or who are addicted to drugs, and then when they look at people who consume foods high in fat and sugar. Another interesting part is that so there are fewer dopamine receptors in obese individuals who have binge eating disorder. So what does that mean? So what happens is, I can kind of see here on my little diagram that this is kind of a normal individual with, and the example is cocaine. So these are the dopamine chemicals. This is a neuron, and this is a neuron. And then these are the receptors here. These are what kind of, basically, the dopamine is released from this neuron, and then it comes through this synapse, which is like a channel, and then it gets picked up by these receptors, and then they go on into the brain, and they cause like an individual to feel good or have pleasure or whatnot. And then when somebody uses cocaine, for example, the dopamine increases substantially. And you can see there are lots more dopamine that are binded to the receptors on this neuron. And so what happens with time is the brain actually compensates for this. The brain reduces the number of receptors on the neuron so that it doesn't, because it doesn't get so much of a jolt, I guess, of the dopamine. So with time, instead of here there's 4 receptors, there would be like 2 receptors or something like that. So you can see that, and this is what kind of drives someone becoming tolerant to either drugs of abuse or alcohol, because they have fewer receptors, so they need more of that drug to get the same effect that they had before. And also, it's also what kind of explains withdrawal from drugs or alcohol, in that now if the person goes back to being normal, it's not using any cocaine or any drugs, the number of receptors on this neuron is decreased, and they don't get the same amount of pleasure that they did before. So what's interesting is that this was actually found in individuals who are overweight and who have binge eating disorder, that there was a decrease in the number of receptors for dopamine. And so that might explain why some people experience, or why we can experience like feeling, either uncomfortable or maybe increased irritability if we go on a diet or you stop eating, sweets or sugars. You might feel, because it may be that there are changes in your brain that are occurring that's causing this. And I don't know if you've seen Super Size Me, the movie. Right, so there's a part in it where he's in the car and he's been doing this. Basically, the movie is where he eats McDonald's every day as an experiment. And at first he's like, I hate this. I don't want whatever. Or maybe a little bit he does like it in some sense. But then after a while, it kind of gets to be very uncomfortable. And at one part in the middle of it, he's kind of like, I feel like crap. He's having all these physical symptoms, but then he eats the McDonald's or he eats the meal and he actually feels better. And so that kind of shows, in a sense, if somebody were to eat McDonald's for every day, or it doesn't have to be McDonald's, you can imagine that the after effects of then stopping, or there are changes that happen in your body. So. Another interesting study multiple studies actually, have been looked at patients who undergo bariatric surgery. So bariatric surgery is gastric bypass or gastric sleeve. It's a surgery that promotes weight loss and for individuals who are obese. And they found that actually the second year after the surgery, there was an increase in alcohol consumption. And they've actually found other studies showing that people were actually they developed problems like alcoholism or alcohol dependence as a result of the surgery, and they had no previous history of having problems with alcohol or any other drugs. But it seems, and so the question here is, or what's been kind of theorized, is maybe there is a link between, for instance, maybe some of these individuals had either a food addiction or some sort of abnormal process in their brain towards food, and they had the surgery, and then now they physically can't engage in the behaviors that they were, or eating the foods that they were eating before, because their stomach is smaller. And so they go through kind of a change, and instead of now going towards the food, they go towards alcohol, which is also kind of uses that dopamine reward system to kind of get that satisfaction. So it's just kind of some of the research is looking at, is there an overlap between people who have either food addiction or binge eating disorder and alcohol or drug use. So next, this is just a cartoon about basically humans in here. They've done lots of studies looking at whether rats prefer sugar water to cocaine, and they've actually found that it's in most studies that's either comparable, or they actually prefer the sugar water, depending on how they do the study, to cocaine. And so another thing that's been looked at is the Yale food addiction study, and that's was developed at Yale. Looking at, can we develop some criteria for food addiction, kind of because right now it's still in the early stages. And so they found, using this criteria that was developed, it's about 25 questions. It's a survey or something that somebody would fill out on their own. They can do it in about 5 minutes. And they found that of 233 normal weight college age women who completed the survey, actually 10% met the criteria for food addiction. So certainly not everybody met the full criteria, but And this kind of goes back to how I was saying that you don't have to be overweight or obese to have some of these. It can occur in normal weight individuals, but it would put someone at a risk for developing obesity in the future. And then another study showed that they did at Yale was they found that 81 obese subjects seeking treatment for binge eating, about half of them met the definition for food addiction. So this is just interesting because it shows or kind of suggests that they are separate things. Someone might have binge eating disorder, another person might have food addiction, but then there does appear to be some overlap. And I don't know that we know exactly what that means exactly quite yet. So what does this all mean in terms of treatment and helping people? I think it's still in the early stages. There's currently a medication called Contrave that has not been FDA approved yet. It's kind of in the works. It's applying to be approved by the FDA for weight loss. But it's basically, it kind of uses these concepts that I've been talking about in the food addiction model. So the medication is a combination of two already approved medications, which are naltrexone and bupropion or Wellbutrin. Now, naltrexone is a medication that is used to treat alcohol dependence and opioid dependence. So people who are addicted to alcohol or addicted to pain pills or whatnot, they can take naltrexone, and what they found is if several months later, they're less likely to have relapsed on the alcohol or the drug use. Not everyone, it's not 100%, but compared to people who didn't take the medication, it was a significant improvement in the number of people who didn't relapse. And so looking at this, they've also found that the thought behind using the naltrexone is maybe it's making food less appealing, people are having less cravings for food, and perhaps maybe that will help people kind of follow a healthy nutrition plan. Now, Wellbutrin or bupropion is the other medication in Contrave, and that's used for depression. It's also used for smoking cessation to help people stop smoking, and it's so it's kind of thought that maybe through it seems to indirectly increase the dopamine in the brain. But perhaps the combination of the two were found in some studies, or in this, the research that they've been doing have been found to reduce weight. But like I said, it still, hasn't been approved for FDA use at this time. So the next third part, I just want to touch about, what are some, tips that you can take home from this presentation about, sustainable weight loss and, what might be helpful So I just come up with a list of a few different things that I thought that are helpful. So one is, listening to your body, and that's talks about mindfulness and kind of, eating without distraction. Don't eat in front of the TV, don't eat on the go. Kind of making it a point to kind of sit at the dinner table either with your family or whomever, and to kind of eat slowly and try and listen to the signal cues of your body. Some of the thoughts are, what is hunger versus a craving? So hunger is, we need food. Like I said before, it's something you can't just stop eating food. And cravings is more of you have a particular food that you want. So you might crave like ice cream or candy or maybe pasta or some sort of sweets or whatever. But you don't need the craving in order to live, right? The hunger you have to eat in order to live. But cravings you could So with this, trying to kind of, when you're going about your day-to-day, if you're feeling like you really want something to eat, thinking about, is this a craving or is this really hunger? And if it's a craving, then it may be beneficial not to give into it, or maybe give into in a smaller amount. Another thing is, learning when you're full, so in stopping eating. So some of the downside of eating like pastas and carbohydrates and breads are that it appears the signals to your brain are a bit mixed up, and people tend to overeat when they eat those foods. So sometimes eating more protein can help, but also just kind of, again, I think if you eat slower, you can learn to kind of stop eating sooner. Like the signals from your stomach to your brain will kind of tell you, okay, I'm full, I don't need to eat anymore. So the next page is a hunger scale. I don't know, it's kind of hard to read, but basically the concept is from 1 to 10, you can rate kind of how your hunger is. So like 1 would be you're lightheaded, you have hunger pains, you're starving, and then 10 being you're nauseous, you like overate, you're like bloated, because you're very uncomfortably full. And so the key that we tell people are to try and stay within kind of the 3 down to either 6 or 7. Yeah, well, not 7, yeah. So kind of in the middle range rather than going to the extremes. Because the problem is if you let yourself get too hungry, then you're more likely to either binge eat later or overeat, and then that becomes very uncomfortable. Another thing is don't skip meals. Try and eat 3 meals a day. Stay on a structured kind of feeding or eating regimen. Make sure that you eat breakfast within an hour of waking up. That's very important. It kind of jumpstarts your day, and it actually increases your metabolism in the morning. So it makes it easier to lose weight. Sometimes people will skip breakfast or lunch, maybe partially in an attempt to lose weight, or maybe they'll say, well, I'm not really hungry then. But it's important to get something in to avoid problems later on. All right. And so next, stop dieting. So, trying to, and the thought is trying to think about your health, eating a nutritious plan long term. Like this is something that you're going to take with you for the rest of your life, rather than, okay, I'm going to go on the cucumber only diet for 2 weeks so I can lose 10 pounds for this wedding, right? Or whatever. I've heard that a lot. And then you kind of, and then you might lose the weight very rapidly, but you're most likely going to gain the weight back just a short time later. So kind of trying to, instead of looking at the mindset of I'm losing weight for this, this engagement or this reason, looking at you're making a lifestyle change, and this is something that's going to be healthy that you want to take with you for the rest of your life. So with that, eating in moderation. So not going to the extremes of anything, not so that you feel content when you eat, yet not overstuffed. Sometimes, if you ban a certain food, it can make you crave them even more. You can kind of play with this as you will, but might be good to kind of avoid banning certain foods. So one way is, another thought is avoid temptation. That means removing food from your home that can be very triggering. So in terms of like chips or whatever it is, just get rid of it. If it's something that's problematic that you snack on in the evening or whatnot, sometimes it's good just to not have it in your house, because you're less likely to eat that food if you go, if you have to go to the store to pick it up, So just don't bring it home, and you're less likely to eat kind of the desserts or the junk food. So that may be helpful. Another thing is to try and have healthy snacks available with you throughout the day. So when you're going to work, if you need to snack on something, have something available, like some carrots or something, yogurt, whatever it is that you like that's not chips or some other carbohydrates that might be problematic. Next part is about emotional eating. So that's kind of what I was talking about at the beginning. And this is sort of kind of brainstorming what are some things you can do instead of engaging in emotional eating. So I think some people get into a habit of, they're feeling stressed or they're bored or whatnot, and then they go towards the food that is to try and help relieve that and give pleasure and relieve that stress. So maybe another route is trying to find something else that you can do besides going towards the food. So that might be, going for a walk or a bike ride, doing something like physical, listening to music. Maybe if, maybe taking a bath or doing some meditation, whatever works for you. It's different from person to person. It's whatever you find as rewarding or as a treat that might be, similar to the food or maybe just a different route. Sometimes I tell people to, if you're having a craving for something, go for a walk, take a walk for, 20 minutes and then come back and see if you still want that or you still have that craving. And a lot of times it's gone. Or maybe talking on the phone, doing something maybe like a lot of people will watch TV in the evenings and then they'll snack on food. So maybe breaking up your schedule a little bit so you break the habit. Maybe instead of watching TV in the evening, do something else. Try and create a different activity that you can do to so that it doesn't become a habit. So the next part is have fun. Maybe get a new hobby or something. Just if you're finding that food is your only reward in life, that's very sad. But try and do something do something else that will kind of bring joy to your life and it's again, this kind of goes to the boredom. Like we go home and we don't have anything to do, so we eat food. So maybe try and do something else, that's exciting. Managing stress can be very helpful. I mentioned this before about meditation or relaxation. This could be exercise, can increase your endorphins. Breathing exercises, all good things. And then exercise. So a lot of times I hear people saying, well, I don't have time to exercise. I can't fit it into my schedule, or it's too hot outside. I hear that all the time in Florida. But start small. Any bit of exercise that you do is better than no exercise. And hopefully it's something that you enjoy, so you'll keep doing and carry into the future. Sometimes working out or doing exercise or activities with other people can help. It can kind of keep you motivated or make it more fun. It shouldn't be something that you're like dreading each day. Otherwise, it's not going to be sustainable. Another thing is to get enough sleep. So make sure you're sleeping well at night, because basically you'll have more energy the next day and you're more likely to be active and feel better, and your mood's going to be improved. You'll probably have less stress. And they've actually found that people who slept more weighed less than people who were having problems with sleep. And that's not necessarily saying that it may be that you're getting a good night's rest and now you're able to do more activities the next day. Or they're looking at whether certain chemicals in the brain, whether they're related in terms of if you're getting enough sleep. They actually found that that the leptin and the ghrelin hormone levels were actually, they changed whether you, when you restricted sleep versus when you actually got enough sleep. So they looked at where they restricted the sleep of individuals, like they didn't let them sleep, and they found that the leptin levels went down. And leptin is what kind of makes you feel full. Okay, and then the ghrelin levels increase, and ghrelin is what kind of causes hunger. So you can see that an individual, if they're not sleeping as well, they may, these levels may change, and they may be more likely to overeat. So it's just something that is kind of being looked at. And the last thing is to get support. Whatever it is, either friends or family, can be joining a support group. Or it could be getting professional help if you need it. Whatever works for you to keep things going. So, and with that, I finished the talk. Well, thank you very much. Thank you again.